ready?
Recording in progress.
Good morning, everyone. We will go ahead and get started. A copy of the Open Meetings Act is located on the table outside as well as on our website. There is also an automatic external defibrillator that is available on the back wall of the legislative chambers. Please stand for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
We will begin with the Douglas County Board of Equalization. Roll call, please.
Commissioner Boyle. Here. Commissioner Kavanaugh. Commissioner Friend. Here. Commissioner Garcia. Here. Commissioner Morgan. Here. Commissioner Rogers. Here. Madam Chair.
Present. Item A, approval of the minutes of the Board of Equalization meeting held Tuesday, August 30th, 2022. And item B, call for a meeting and set Tuesday, September 20th, 2022 as a date for hearing on certified assessment corrections reflecting the addition of omitted property or increased value on property. Is there a motion to approve A and B?
So moved. Second.
Motion by Commissioner Rogers, second by Commissioner Morgan. Any questions or comments? Please vote.
Motion passes 7-0.
Next item is citizen comments. Is there anyone wishing to speak to the Board of Equalization about an item not on the agenda? Seeing none, we will move to resolutions D through G. There is no need for executive session, so the motion could include adjournment.
So moved. Second.
Motion by Commissioner Rogers, second by Commissioner Morgan. Any questions or comments? Please vote.
Motion passes 7-0.
We'll move to the agenda for the Douglas County Board of Corrections. Roll call, please.
Commissioner Boyle.
Here.
Commissioner Kavanaugh. Commissioner Friend.
Here.
Commissioner Garcia.
Here.
Commissioner Morgan.
Here.
Commissioner Rogers.
Here.
Madam Chair.
Present. Item 1, approval of the minutes of the Board of Corrections meeting held Tuesday, August 23rd, 2022. Is there a motion to approve?
So moved. Second.
Motion by Commissioner Rogers, second by Commissioner Morgan. Please vote.
Motion passes 7-0.
Next item is citizen comments. Is there anyone in the chamber wishing to speak to the Board of Corrections about an item not on the agenda? Seeing none, we will move to the report for the from the Director of Corrections, Mr. Mike Myers. Good morning.
Good morning, Commissioners. Michael Myers, Director of Corrections for Douglas County. You have before you your report for the month of August. Enclosure number 1, Administrative Services. Following the second month of the fiscal year, we are $822,225 under budget. There were $411,558 spent on overtime costs in August, which was comparable to the previous month. Enclosure number 2, Community Corrections and Reentry Services. The Sanction Center and Transitional Discharge Center placed a total of 21 individuals in community corrections, which saved 113 bed days in the jail. The 24/7 sobriety program administered 62 individuals, admitted 62 individuals. There were 3,244 breath tests conducted. 7 were positive for alcohol, and there were 23 no-shows. And the overall compliance for breath testing was 99.1%. 51 individuals were monitored for a total of 1,186 scram days of monitoring. And there was 1 no-show, 1 tampering violation, and 0 alcohol violations and the SCRAM compliance rate was 99.8%. There were 1,003 drug tests administered with 113 violations and 4 no-shows. There were 28 drug testing patches submitted for testing with 4 violations. Work release admitted 15 individuals. House arrest admitted 70 individuals. The Reentry Assistance Program, or RAP, admitted 44 individuals, and 1 individual achieved a GED. Reentry services in the therapeutic communities, there were 133 individuals admitted to therapeutic community housing units, and 1 individual achieved a GED there. 31, on to pretrial services, 31 individuals were referred for priority prosecution, saving 163 bed days. 433 individuals were placed on pretrial release. Overall, 1,076 individuals were managed on pretrial release throughout the course of the month with a 93% compliance rate. 121 individuals visited the law library, and the enhanced pretrial release program is scheduled to launch on September 26th. Enclosure number 3, compliance. Our regular documentation is being collected for all compliance processes. Our Prison Rape Elimination Act audit was completed in July. We have just recently received the report and will review and implement any recommended changes. And our annual security audit is actually going on this week, September 12th through the 16th. Enclosure number 4, personnel. 6 officers below the rank of sergeant left employment in August. And this includes the loss of Correctional Officer 2 Zachary Burrell, who unexpectedly passed away last month, and I will come back to that later in my report. 8 new officers began training on August 22nd, and they will graduate this Friday on the 16th of September. Due to a smaller class size and current staffing needs, we have implemented an accelerated training academy, which will provide the same number of hours of training but will conclude 1 week sooner. Numerous staff were recognized for monthly meritorious service awards. More than 25 staff volunteers were trained as peer support specialists on all shifts. This is a tremendous show of unity and dedication to the well-being of their coworkers. And this is one of several initiatives in the works to support our staff, to build their resiliency and improve retention. And I will circle back to that later in my report as well. Enclosure number 5, population. There were 1,377 admissions in August. That is an increase. There were 1,285 releases. Our high count was 1,139, and our low count was 1,093. Our average daily population was 1,117. That was an increase of 44 per day over the month of July. There were 74 custodial bed sanction days. That was a decrease. The U.S. Marshal population increased. The felony pretrial population increased. The misdemeanor pretrial population decreased slightly. Probation violations increased slightly. 18% of our population were between the ages of 18 and 24. 66% of our population were minorities. 15% of our population was female. 15%. 18% of our population was homeless or nearly homeless. Enclosure number 6, medical. There were 1,118 intake screenings and 366 health and physical assessments. Inmates were sent out 30 times for emergent medical care 12 of those were by 911. There were 9 hospital admissions, which resulted in 19 days of hospitalization. There were 62 off-site medical appointments. Enclosure number 7, mental health. There were 151 initial psychiatric assessments. There were 4 initial mental health assessments. There were 114 mental health infirmary placements. 106 individuals were placed on drug and alcohol withdrawal protocols. We had 9 referrals to the Board of Mental Health, and 3 individuals were transferred to long-term psychiatric facilities. Other noteworthy items: we continue to respond to the COVID-19 pandemic. There were 3 known cases of COVID-19 among the incarcerated population. 30 staff members tested positive throughout the month, which was a big increase for us, and it was really the first time I've noticed that our inmate cases and staff cases didn't trend in the same direction at the same time. Our staff vaccination rate remains at 75%. We administered 58 first doses of Moderna, 17 second doses of Moderna, and 15 booster doses of Moderna. And separately at Community Corrections, the Douglas County Health Department administered 24 second doses of Moderna. As of September 1st, we have fully vaccinated 1,806 incarcerated individuals and provided boosters to 208 individuals. We are just now beginning an educational campaign to encourage our staff and inmates to receive the Omicron-specific COVID vaccine booster, as well as their annual influenza vaccines. Full deployment of our body-worn cameras has been achieved. We are one of the first jails in the nation to have this resource. A demonstration of these cameras will be provided at an upcoming board meeting. We have also, in August, established a recruitment team of staff members who will represent DCDC at local colleges and job fairs to boost our recruitment efforts. And we have also created a recruitment video, which has been shared on our social media platforms, and I will present that video at next month's meeting. Officer Zachary Burrell unexpectedly died last month at the age of 28. He served the Nebraska Department of Correctional Services for a few years before joining DCDC approximately 2 years ago. Our department has now lost 4 officers to untimely deaths in the span of 16 months. Several other officers have faced life-altering health struggles. And I commend our staff on how they've rallied around each other time and time again in the face of these tragedies. And I'm blessed to be associated with such wonderful people. I brought a guest this morning, Sergeant Matt Lewis, who I'm also blessed to be associated with. Several months ago, might even been close to a year ago, Matt came to me with an idea that he would like to leave as his legacy at DCDC. More or less, Matt is in the twilight of his career at DCDC, having served the county for over 20 years. He disclosed to me the impact that this difficult work has had on him, both physically and emotionally, over the course of over 2 decades. Matt and I assembled a planning team comprised of the leadership of the FOP and the ACOA and other staff who have shown an interest in the health and welfare of their coworkers. From there, I got out of their way, and under the direction of Captain Leon Valkier and Sergeant Lewis, the concept of a team of peer support specialists was brought from an idea to a reality. In August, mental health professionals from the First Responders Foundation provided 3 days of training to over 25 staff covering all shifts and operational areas of DCDC. In the coming weeks, their efforts will be supported by an app, which will allow our staff members and their families to access resources 24/7. Unfortunately, this team was called into action when we learned of Officer Burrell's passing. And while I hated those circumstances, I was sure grateful they were there and ready that day and each day since, as they have followed the individuals who were most deeply impacted by the loss of Zachary Burrell. And I'll conclude my report by inviting Sergeant Lewis to come forward and talk more about this project.
Thank you, Director. Good morning, Commissioners. Sergeant Matt Lewis, Douglas County Department of Corrections. I've been in corrections for just over 24 years. Started my corrections career in 1998 with Douglas County, took a little sabbatical for about 6 months and came back. So some of the statistics you guys have heard several times from Officer Bill Young. I know he's been in front of some of you in the past. Depending on what study you look at, corrections officers suffer 27 to 34% of correctional officers suffer from PTSD. The suicide rate in corrections is 3 times that of the normal population. I know that there's, whether it's being cops, firefighters, corrections out there, everybody faces some traumatic situations in their careers. Through my 24 years, I've seen a lot of things happen that truly did affect me emotionally. And when I sat down with Director Myers and Deputy Director Redmond, and they asked me why I was passionate about this, and I said, Mike, I don't want people to be me in 20 years. That was my goal. I was blessed to be the Fraternal Order of Police Lodge 8 president for 2 terms, and that's when this started. I had the opportunity with several other members of the FOP Lodge 8 to go to a seminar, a free seminar that was put on by the First Responders Foundation by a gentleman by the name of Dr. Kevin Gilmartin. Kevin is a retired cop who became a psychologist, and this is his passion. After that, we sent Bill Young, who I'm sure you've talked to, and Bobby Hike to some training with Desert Waters, which is they support corrections, and he went through a fatigue to fulfillment class, both of those individuals, and came back with some information. So this has been a project long before Director Myers, but Director Myers, once I brought it forward to him, he was supportive and wanted it to happen. So from there, started doing a lot of research, and got with Omaha Police Department's peer support individuals who were a great help and gave us some of their policies and a lot of contacts that they used and some ideas. And from there, myself and Captain Leon Valkyr took it forward with a group of other officers that were selected to bring this to reality. So the beginning of August, we had a course that was offered by the First Responders Foundation. Jason Workman, who's a psychologist that works with him, put us through a 3-day course. And since August 2nd, we've had contact with over 40 staff in the jail, which is huge because if you know corrections, you know first responders, they don't talk to anybody. Employee assistance program is a great benefit that's offered to us, and it is used by corrections officers, but following some critical incidents, they may not want to talk to somebody that doesn't wear a badge. And that's what we're there for. People who can relate, who have been there and done that. Everybody on our team get no perks. And that was when we selected the individuals, that was clear to them that this was not a resume builder. If you're putting in for this team, you're putting in for it for the right reasons. So we interviewed several individuals. And again, as Director Myers said, there are roughly 24 people on our team, which consist of uniformed, non-uniformed staff to include 2 chaplains. We have another chaplain and 3 more staff members going through a free training seminar here in October, or I'm sorry, it was moved to November. So it really surprises me the number of individuals we've had come to us. Within our program, we set it up so supervisors or any employee within corrections can refer somebody to us. If they see an officer, a non-uniformed staff member having issues, whether it's a work issue or an issue at home, they can come talk to us. We have a list of first responders, supportive doctors, psychologists, and psychiatrists that are available to those staff members. I have currently referred 2 individuals to mental health practitioners outside of the facility, and those 2 individuals, you can see a change in their attitudes. So the goal of this program, keep people around. We know not only in Douglas County Corrections, but through the United States, corrections is hurting with staffing levels. Nobody wants to do the job. It's not only critical incidents that affect us in the field that we work in, just the negative environment you're exposed to. You know, working 16-hour days, coming in, not knowing if you're going home to see your kid's football game on a Friday night, or if you're gonna have to work till 11 o'clock instead of 3 o'clock. Everybody down there is hyper vigilant. You don't know, I may sit behind my desk one day and not have to do much at all, but the next day I might have to talk 2 guys out of suicide and split up 3 fights. So those are the things we go through in corrections, and it really does affect you outside. And I've had some issues in my personal life, not all because of the career, but those stressors coming home certainly affect what happens at home. So I appreciate the opportunity to come forward and talk to you guys. It really is a passionate group of people, and I hope that this helps retain some of our officers and keep them around for a while. But entertain any questions if you have any questions for me. If not, I'll step back and leave you alone.
Thank you very much. We do have a couple questions, but Mike, were you finished with your report?
I am concluded.
Okay,
So,
all right. And again, thank you, Matt, for coming forward.
Thank you.
Commissioner Kavanaugh?
Thank you. Sergeant Lewis, thank you for this. It's a valuable insight. They're good people doing a real tough job, and we appreciate what you do and recognize that it takes its toll. I had no idea that corrections officers have 3 times the suicide rate as the general population. As a matter of fact, I believe there's a resolution on later in the agenda to recognize this as National Suicide Month. So what you are doing with the first responders program, I think, is a key component to helping our stressed out corrections officers cope with a really, really tough career. And thank you for that. And I know as a leader of the FOP down there, you have served for many years in a point position with the corrections officers, and I appreciate that and want to recognize you as a positive leader in the corrections department that has done a lot over and above the call of duty over many, many years, and so thank you. This is a really interesting program, and I'd like to learn more about it, that you're collaborating with the First Responders Foundation, if I heard that correct. Just real briefly, what exactly is that program that went on in August, if you could tell us?
The First Responders Foundation, Jason offers a class which is basically a peer support, basic training. So he sat down with us over the course of 3 days and talked about different mental health disorders, talked about some of the statistics, what to say, what not to say when you're dealing with a person in crisis. Gave us a lot of ideas on how to design our program and where to go. And he also did, Jason's very passionate about what he does, so he gave us his personal contact information in case something comes up that we need to get a hold of him. So the 3-day course was basically how to approach an individual in crisis, or how to conduct a post-critical incident. I don't want to call it a debriefing because it's not. Basically, if we have a critical incident, we're going to deploy peer support team members to sit, and whoever wants to talk to them can come forward on a one-on-one basis and talk to us about some of the rules of confidentiality also. Everything that comes to us is 100% confidential. We don't share names even within the peer support team. The only time that we break confidentiality would be, threats of self-harm or harm to others. So, and Jason really covered all of those things with us. So
That's great. Thanks again for this update, and I appreciate the work that you and your fellow officers have been doing to help alleviate some of the stress experienced by corrections officers just doing their job. And I want to commend the director as well for collaborating on this effort with the corrections officers. It's really important that we all work together on this. It's an awfully tough job that you do. Believe me, we appreciate it. Thank you.
thank you.
Commissioner Friend?
Thank you, Madam Chair. Sergeant Lewis, the information you and the information Mike provides every month is obviously valuable. The information you provide now, these words seem hollow from a person like me, but thanks for all of the years that you've put into this, because obviously it's very much needed. Like I said, the words seem hollow, they sound hollow, but I can't express that as forcefully as I need to. But thank you, and continue as long as you can for us the type of help that you're providing. Would you mind, can I ask Mike a couple quick questions, real quick, Sergeant? Mike, thanks for the report. This is a quick one. If the daily population between August and September is about just over 1,100, you've probably said this before. What percent of capacity are we right now? If you're going from that point in the month to this point in the month, how much room do we have? Because I noticed increases, not just with the U.S. Marshal population, but the felony pretrial release population, misdemeanor pretrial decreased slightly. So that's my question. I mean,
Sure.
Are we okay?
We are okay population-wise in terms of we've had 4 housing units closed, and we were able to maintain that even though our average daily population went up by 44. We were able to not open any other additional housing units with, I'm going to give it a caveat. There was an exception. There was a couple of times we did open one for a short period of time because the female population itself got higher than we could contain within 3 housing units for a few days.
Okay, and that leads me to this final one, and those are a concern to me and probably other commissioners and people that are as close as they can be to the situation, is that it's not just about the capacity, it's about our ability to manage the capacity. So what I am getting at is, can you, when we talk about on this page 3, the mental health stuff, the enclosure number 7, how many of the drug and alcohol protocols are synonymous with the mental health infirmary placement? So do they mesh?
No,
Are they totally
those
separate?
are completely separate.
Okay. And can you quickly explain, and I'm sort of a layman, can you quickly explain what practically happens with a mental health infirmary placement? So 114 were placed in that. Can you tell me,
Sure.
maybe not in a paragraph, but
Absolutely. I can do this pretty succinctly, actually. Those are, almost by and large, those are people on suicide watch. So those folks are monitored very closely. What they're allowed to have in their possession in their cells is much different than their clothing's different, everything's different for those folks. So during the month of August, we had 114 individuals that we identified as a suicide risk that were placed in the infirmary.
okay, and that means you're moving them into, and I've taken 2 tours, but one not very recently, but I can't remember where it is. They're cordoned off into a separate, not pod, but a separate area.
A separate housing unit. It's our medical infirmary.
Right, and is there capacity in there for 100? We're probably pretty close to capacity in that environment.
That is always pretty cramped space.
Okay. All right, well, thanks, Mike. We'll continue the dialogue, and I'll talk to you again. Thank you, Madam Chair.
Commissioner Boyle?
Yeah, and thanks again. I just want to reiterate, Sergeant Lewis, that what you're doing is an incredible feat. Because when you think about what our vision is of folks who are in law enforcement, I mean, there's a wall there, so you don't expect them to show emotion. So for you to create this, I think it has a lot of credibility coming from someone who's in the trenches with everybody. So what you're really doing is creating a culture change in law enforcement to destigmatize mental health, and that is a huge task. So you're not only doing things that are going to help with turnover of staff, but you're going to teach them to take care of each other, and you're really helping them become intact human beings outside of work. And there's no bigger gift or better cause than that. So thank you for what you're doing with that. And then for Mike, I just had some questions on the pretrial release. You mentioned that 93% of folks were compliant with that and 7% were not. When they're not compliant, I was just curious how, number one. And number two, you mentioned the new pretrial release program. Can you talk about that a little bit?
Sure. So currently, when a judge puts somebody on pretrial release, there's a call-in system, and individuals have to call daily just to inform us. It's an electronic system. They call in to inform us that they are still present, they are still in Douglas County, they haven't fled the jurisdiction. So that 93% reflects the people who are calling when they're supposed to be calling. When they don't, when they become non-compliant, they are first sent a letter, and then if they don't can improve their compliance, then we notify the courts. And then the courts can take any action that they deem necessary at that point. Oftentimes the courts will wait to see if the person comes to their court date. They really aren't going to issue typically they haven't issued a warrant to see if somebody's, because they haven't made the phone call. The new program is much more robust, has many more options. It actually was supposed to start today, but there's a pretrial conference that most of our staff are at, the supervisory staff, so we didn't want to start to go live with it until everybody was back and settled, and we didn't want to get off to a bad start with that. The new program will have much more information that's provided to the courts at the time of bond setting, any subsequent bond reviews that might happen, as well as the ability for the courts to have access to data systems so they can see how individuals are doing in complying with the conditions of their bond, such as drug and alcohol testing, GPS monitoring, the check-ins, the face-to-face check-ins. And this is, the goal isn't to supervise the people who've already been getting out on pretrial release more strongly. The goal is there's a certain subset of people that we believe in the jail that we could manage outside with supervision and support before their court dates. And so it's a smaller group that the new program will impact. At least that's the goal of how we hope the judiciary approaches it, and how we're trying to educate them to approach this is not over-supervise people who don't need it, but to allow appropriate supervision and risk mitigation for people who probably, especially people who have jobs, families who have some things going for them in life that would completely be disrupted by a lengthy pretrial detention.
Good. All right. Thank you.
Commissioner Kavanaugh?
Thank you. Following up on one of the points that Commissioner Friend raised regarding the drug and alcohol question, there's an indication in here that we have withdrawal protocols for inmates who evidence drug and alcohol problems. I think this is on page 3. And the component of the population of about 1,100 that present with that is noted at 106, or about 10% of these people. I seem to recall that we had a drug and alcohol counselor, Dwight Peterson, who had for many years helped us out with that. Is there somebody, and he's passed away,
Right.
Is there somebody who's performing that service currently?
We have a variety of service providers. Probably the biggest partnership is with the Community Mental Health Center with our intensive outpatient co-occurring mental health and substance abuse treatment program. And we have another one of those programs that's in community corrections, and the mirror image of that program will launch in the jail soon. It's 100% grant funded for the next few years. We have many different providers that come in and do drug and alcohol dependency evaluations. That's a key component of expediting those folks getting out of jail and getting placed into treatment programs and hopefully moving forward with their lives. So there are a plethora of resources that we have. These specific are just the people who have come in under the influence, and we need to monitor their physical health for the next several days while they withdraw from the substances that they were in their bodies while they were arrested.
So I believe Dwight Peterson held like ongoing AA, NA meetings inside the facility with the population.
Absolutely. And those are still ongoing. We have many different 12-step groups that happen. Pretty much our classrooms are full almost every day of the week.
Also, on page 3, you indicate that long-term psychiatric facility referrals were 3. Which long-term psychiatric facility are they referred to?
That is the Lincoln Regional Center.
I'm sorry?
The Lincoln Regional Center,
Okay.
the individuals who are ordered there.
And would these individuals be individuals who are being held or processed on local misdemeanor charges, or would they be awaiting trial on felonies and being analyzed for perhaps an insanity defense?
Yes, is the answer to that question.
Both?
Both. I would primarily felony offenders, those who are either going to the regional center to have their competency restored or for competency evaluations.
Thank you. You know, in light of this and, you know, the graph that we get every month from you is always kind of chilling. The high incidence of people who have mental health issues and people who have drug and alcohol issues. Again, Sergeant Lewis, it's really remarkable what you and your fellow officers are able to do under these extraordinary circumstances with people who, you know, they might be being processed through the criminal justice system, but a lot of them are there because they have mental health problems and have acted out, or they have drug and alcohol problems and they have acted out. And we are engaged in a discussion about how we can better treat that underlying situation. There's a series of town halls that we will be hosting here starting the 15th, and I would encourage you, Matt, to grab a copy of that over at our office and share it with the officers at corrections, because as the frontline people, you're actually the frontline providers for a lot of this in the corrections department. It would be invaluable to get your insight at one of these hearings or more. Thank you, Matt.
Commissioner Morgan?
Thank you very much and your team for what you all do in a challenging situation. One of the things I wanted to mention, which Commissioner Kavanaugh just touched on, is Thursday night at 6 o'clock, we'll be in Building 22 in Fort Omaha for a town hall meeting. Our chairperson, Commissioner Borgeson, has been the leader in wanting us to do more, and I know your report shows, I think, 897 mental health diagnostic situations that would be for the month.
Right.
And I want Mary Ann, of course, Commissioner Borgeson, to correct me, but that's why this is such a priority, and I think it's really important that hopefully we get great input, because this is a challenge that really we're mandated to deal with in the correction facility. And I hope we can get some community partnerships going in that area also. And then the other part of it that you touched on is the homelessness. They're not necessarily charged with the crime, but the police don't have any place else to take them but to our correction facility, if I'm accurate on that.
Well, they do have to be charged.
Loitering or something like that.
Correct. They do have to be charged to be brought to our facility with something.
Right.
But oftentimes, I think there are law enforcement officers who would, if they had a better option, they would take it, and I'll leave it at that.
Right.
Yeah.
And I think you can be taken there if I'm sitting at one of the ramps on the interstate that's an exit ramp. I haven't done anything, but I'm maybe just there, or laying in a storefront sleeping because I am homeless. And, it's really a tragic situation, and there aren't other places that take that individual. So, Mary Ann, you may add to what I've said, but it's so important that we get community input on this because there's a cost factor involved, and rather than us just doing something, it's great to have that input and why we're doing it. And when you see these numbers, it's shocking because I know you and I've talked about it's over 60% of the people that are incarcerated have that situation of mental illness. Okay, thank you.
Thank you, Commissioner Morgan. I too, again, want to say thank you. I think this blends very well into the board's priority of mental health, and not only just for what we're responsible for at corrections, but at our mental health facility, those individuals. But when we started and should be hopefully launching in November, the mental health first aid for staff, that will blend very well with this new program. You know, we were concerned so much of those on the outside of our four walls, and now I think we need to also lend attention to our staff who, through the pandemic, before the pandemic, and continue today to serve, even though they struggle as well. And this will help staff be able to identify and respond, as you spoke about, to those situations, because peers to peers are probably more apt to have that conversation than a peer to management. So I think it will blend very, very well. Mike, on page 3, on the enclosure 6, so
Yes.
there, the bottom 2 bullet points about inmates that were sent out 30 time for emergent medical, that's not graphed anywhere.
No, it's
Right.
not.
Okay. Well, the reason I'm asking is because as I look at, or if I'm remembering, and it's not so good as it used to be, but it seems like those numbers are increasing in terms of having to send individuals either through a 911 call or to specialty care.
Mhm.
So if we could, again, graph that.
Sure.
You can just do it for this or last fiscal year and now,
And then move forward.
so that we can watch that. And
Absolutely.
then what they're being sent out for would be good to know as well. And I think that's all the questions I had, but again, thank you very much for all you do, and please relay that to staff as well.
Absolutely. Thank you, commissioners.
Thank you. Yes, Larry?
Thank you. Larry Storr, 5015 Lafayette Avenue, Omaha, 68132. I've been coming down here for quite a few years and listening, and I keep hearing these words about community input and discussions, but I don't remember where the citizens very, very often actually gets to have a discussion. And I've heard them say that you're not allowed to discuss with citizens. Those things need to get changed. And it appears that the programs that we're spending money on are not as effective as we would hope. We all have hope to help and a sincere desire to help. But I wonder if we're listening to too many people outside of this city and outside of this state. These national associations who have best practices that work for somebody else. And forgetting that all these resources that we have here, we just heard Mike say, we have lots of different resources that are helping these people. But is it successful? So let's have that discussion. Let's have that input, citizens with the providers here locally, and let everybody discuss it instead of passing this and passing that and still coming back to the same thing. We've got a growing problem. We need to fix it. I don't know how either. Thank you.
With that, no other agenda items for the corrections. Is there a motion to adjourn?
Second.
Motion by Commissioner Rogers, second by Commissioner Friend. Please vote.
Motion passes 7-0.
Agenda for the Douglas County Board of Commissioners. Roll call, please.
Commissioner Boyle? Commissioner Kavanaugh? Commissioner Friend?
Here.
Commissioner Garcia? Commissioner Morgan? Commissioner Rogers? Madam Chair.
Present. And before we begin, I just want to take a moment and congratulate a couple of our folks. First, Commissioner Garcia and Marissa Hatab, our DEI officer, were grand marshals for the first, and I think it's going to be annual, Tri-Faith United We Walk event this past Sunday. And the whole purpose of that is to bring the entire community together to celebrate our diversity. And so congratulations on that recognition to be picked as the first to represent us. And then secondly, our very own Erin Nelson, who is our long-term care administrator, has been picked as the 2022 Administrator of the Year. She was nominated by our Douglas County Health Center executive staff, and there's a plethora of criteria that she had to meet, and she met them, and she was recognized yesterday at the luncheon that was provided by the Nebraska Nursing Facility Association and Nursing Assisted Living Association, again, as their administrator of the 2022 year. So we congratulate her as well. With that, we have item A, approval of the minutes of the Board of Commissioners meeting held Tuesday, August 30th, 2022. And item B, approval of claims submitted for payment processed through Tuesday, September 13th, 2022. Is there a motion to approve A and B? Motion by Commissioner Rogers, seconded by Commissioner Morgan. Please vote.
Motion passes 7-0.
Next is our consent agenda, items A through I. Is there a motion to approve? Commissioner Kavanaugh. Motion by Commissioner Rogers, second by Commissioner Morgan. Commissioner Kavanaugh.
Thank you. Just a couple of informational questions on item G. Discussion and action regarding the implementation of a pay plan for the Douglas County Attorney's Office. And I'm aware of this going into effect. I'd just like to have a couple of things for the public record. First off, I note in the resolution that it becomes effective September 2nd of this year, which has gone by. And I'm just curious of how the backdating has occurred in this item.
Teresa, your County Attorney's Office, and Karen Butch is also on Zoom and has assisted with the creation of this pay plan, so she's also available for questions. It's not uncommon at the beginning of a year that there's a small amount of arrearages when a pay raise goes into effect. This was just drawn up so that it would begin in the beginning of September. It says the first pay period after September 2nd. That's also the beginning of a pay period, which would be September 4th. So it was intentional to make it coincide with the beginning of a pay period. It just happened to be at the beginning of September.
Okay, so people have already been paid under the old scheme?
We're paid in arrears, so it should be. We did talk with HR and payroll as well. It should be fine. We're all paid in arrears, so it shouldn't be an issue.
Okay. And I understand the need for this based on, staff loss and shortages, which we experience systemically. I mean, I heard a report on the radio coming down about a teacher or a nurses strike in Minneapolis based on nurses shortages, and we've experienced that. We've just heard from our corrections officers about the staffing in our corrections department. So I understand the underlying need to adjust our compensation because of that occurring in our attorneys' staff. I have had discussions with Mr. Lorenz, who I don't know if he's, oh, there you are, regarding the actual cost of this, which seems to be fairly modest. And Joe, could you give us an outline of what that would be?
I think when we talked about it, Teresa, in executive session, didn't you tell me it was about 200,000?
A little over, Teresa, York County Attorney's Office. So it's, we have the money in our budget for this year. We will be asking to work that into the budget for future years. It is a little over, it was around like 215.
Okay.
And the number of individuals, these are all attorneys that we're talking about, is that correct?
Yes.
The number of individuals who would be affected, do you have an idea?
It would be our entire attorney staff. I don't have the exact figure.
Approximately, do you have any idea?
I would just be, I wouldn't want to speculate. I wouldn't want to give you an incorrect number, Commissioner.
Okay, thanks.
But it's our entire attorney staff.
It's dozens of attorneys, though.
It's many, yeah.
Thank you. I think this is, a step that's, in light of the staffing issues that we've been facing, is probably a step in the right direction. And with the modest cost of this thing, is probably a pretty good investment. Thank you.
No other questions or comment. There was a motion and a second to approve our consent agenda items A through I. Please vote.
Motion passes 7-0.
Next is a resolution recognizing September as National Suicide Prevention Awareness Month, and I'm going to read this resolution. Whereas September is known in the United States as National Suicide Prevention Awareness Month and is intended to help promote awareness surrounding the suicide prevention resources available to our community. And whereas the simple goal is to learn how to help those around us and how to talk about suicide without increasing the risk of harm. And whereas suicidal thoughts can affect anyone regardless of age, gender, race, orientation, income level, religion, or background, and according to the Center for Disease Control, CDC, suicide is the 10th leading cause of death overall in the United States, claiming the lives of over 47,500 people annually, and is the second leading cause of death among individuals between the ages of 10 and 34. Whereas Douglas County chooses to place its full support behind local educators, mental health professionals, coaches, PAC leaders, police officers, and parents as partners in supporting our community in simply being available to one another. And whereas our regional organizations like the Nebraska State Suicide Prevention Coalition, the Nebraska Region 6 Behavioral Health Care, and our national organizations like the National Alliance on Mental Illness, the National Suicide and Crisis Lifeline, Hope for the Day, and National Association of Counties National Council for Well-Being Mental Health First Aid Program are on the front lines of a battle that many still refuse to discuss in public, as suicide and mental illness remain too taboo of topics to speak on. And whereas starting in July 2022, dialing 988 from anywhere in the United States has been designated as the new 3-digit dialing code that will route callers to the National Suicide and Crisis Lifeline. And whereas every member of our community should understand that throughout life struggles, we all need the occasional reminder that we are all silently fighting our own battles. And whereas a simple phone call, message, or hug can go a long way towards helping someone realize that suicide is not an answer. Now, therefore, be it resolved by this Board of County Commissioners, Douglas County, Nebraska, that this board hereby declares the month of September as National Suicide Prevention Awareness Month, and encourage all county officials, employees, schools, and our residents to learn about suicide prevention and to take the time to inquire as to the well-being of their family members, friends, and neighbors, and to be sure to express care and appreciation for that person or persons. Dated this 13th day of September, 2022. Is there a motion to approve? And I just may add, Commissioner Roger Garcia and I were contacted by an organization called Hope for the Day, and it's an organization that brings resources free of charge to the community, and we can hold, I think it's 2 events in a year where they'll bring those resources into the community to talk about and educate and build awareness around suicide prevention and awareness. And so this Labor Day, they provided us with wristbands and just a little card that said Hope for the Day with some information on it. And those were passed out throughout the parade route by the my husband's entry from the Smart TD folks. And so I meant to bring those today and forgot, so I will get those to you. I kept one for each of you. I know, but I'll bring those to you. But it was very well received, and we thank Hope for the Day for reaching out, and thank Commissioner Garcia and Leah Baez from our staff for the help in organizing that. And then we'll begin to work on one other event that we could potentially use those resources for. So with that, anyone else? Larry?
Thank you. Very quickly. I agree in spirit with the resolution. But before you vote, I'd like to request something that you add into it. Along the terms of these discussions and citizen input things, we need to have a discussion about the truth to the charges nationwide, that the rate of suicide among teenagers, particularly young people, has soared. We need to talk about why. A lot of people are claiming it's due to this social media and this critical sex education and the disgender, misgender, all these different classifications of things have got your children so confused, and they're talking with each other on social media and convincing each other the only way out is suicide. Let's discuss those things. Insert that into the resolution, and maybe that'll get a discussion going with all the community providers and resources and experts. Let's hear that from government. Thank you.
With that, we did have a motion and a second. Commissioner Morgan?
I was just going to comment. I heard this just in the last few weeks. It's a leading cause of death between people of the ages of 18 and 45 is suicide, which is pretty shocking. So, with the car accidents and all the other things, that's the leader, unfortunately.
Yep.
So, thanks for the resolution.
Yep, and I'm actually proud that our board has made this, again, a priority to really take action on. So, Commissioner Kavanaugh?
Thank you. Yes, I wholeheartedly agree with the sentiments expressed, and I'm appalled at the statistic that my colleague, Commissioner Morgan, points out. And I think, Larry, we don't agree often, but on this we probably are close to agreement. But this is a scourge among our younger people, and we need to do whatever we can to help address that. So I want to say that this is a good step in recognizing that the problem is there. It's immediate, and we should take as many positive steps towards addressing it as possible. So thanks.
All right, with that, please vote.
Motion passes 7-0.
Next are citizen comments. Is there anyone in the chamber wishing to speak to the Board of Commissioners about an item not on the agenda?
Larry Store, 5015 Lafayette, Omaha, 68132. Very quickly, this is not on the agenda, but Mary Ann brought it up a little earlier about the United We Walk over the weekend. I'd like to submit this. Mainly for the reason to help start another discussion of the material that is in that booklet. How we can have discussions with the community of Muslims and Jewish people and Christians altogether. How it may or may not work. Primarily, though, this morning, I want to talk about the elections again because it's coming up very fast. There is a very fast-growing, vocal association of citizens who believe in the Declaration of Independence. And it appears that with the state of affairs being what it is nationally, that the only way for us to follow the spirit of changing your government, altering your government, amending your government, whatever you want to call it, per the Declaration, that also applies to city and county governments when they are not doing what we the people hired them to do or elected them to do. We can amend. We can amend yours too. We can amend the city charter. And there is a growing movement to do that. But I think there's something I want to read from an email I got in regards to that. Do not believe the lies about our chances to elect a new Congress. And our allies in the election integrity movement have accomplished a lot around the country in various states, and we aren't going to stop. For instance, maybe you didn't realize this, but you do have a direct impact on election integrity in America. Over the past year, you did have. Thanks to you, these are all the results so far, which I won't go into. But his point is that do not be demoralized by articles from the establishment and left-wing sources. Do not be depressed by suspect polling that shows things suddenly falling apart. This is a strategy to get you to stop your efforts to work the elections or get out the vote or to cast your own vote and to make sure that your vote is secure, that it is counted, not by machines, but it's a paper ballot counted by people. And we can observe that and we can audit that. That's what the real elections should be about. But we have politicians nationwide that are trying to prevent even that. So we, the people, are beginning to rise. And we're going to try to tell you people what your job is, because we are the people. You answer to us, not national associations,
1 minute.
To help you get around citizen inputs, so to speak, or how to control the elections. We expect honesty and integrity from every state election official and every county election official. And we are beginning to go to small counties and get the sheriffs involved when we think there's some sort of fraud going on. And it is their duty and your duty to make sure that there is not. Not to cover it up and not to deny us a discussion about it. It is, we are the people, not you. Thank you.
Anyone else wishing to speak to the Board of Commissioners about an item not on the agenda? Seeing none, we will move to presentations. We have a presentation of a resolution to approve a Douglas County Adopt a Road program. If you remember, this was presented a few months ago, and it was brought to me by a citizen by the name of Julie Dunbar, who it was kind of like one of those, oh, why don't we have an Adopt a Road program? And we met with the county engineer's office, and they just got to work on it like no other, and we're ready to hopefully approve it and launch it. And we have our Dan Kudelek, here today from the County Engineer's Office, Deputy Chief, to tell us all about it.
Thank you. And thank the board for allowing us to go forward with this, particularly you, Commissioner Borgeson. We've been diligently working in the last few months trying to put this program together, and we have put it together. And I'm here today to get, hopefully, your approval to go forward with this with a county board resolution authorizing the Adopt a Road program. I need to thank a few people besides the county engineer and the commissioner. The county attorney's office was very helpful in putting together the application agreement. It has all of the right words in there to protect our interest legally. It puts the burden on the sponsor of this project basically to make sure that they follow the safety rules that will be outlined in detail to the groups. And we will actually physically hand out a safety brochure to the sponsor to hand out to the participants to read and go over and make sure they do the right thing, because it is potentially a dangerous situation, but hopefully I think the people that would be interested in this have that sort of understanding that this is something they have to be serious about. I need to thank our own staff, our IT people, our traffic people. They have been pricing, and I think they've already purchased some of the material that we will be furnishing, such as the trash bags and the vests, that type of thing. And we will hopefully have a healthy turnout of volunteers. It's absolutely a great way for citizens to do something productive for Douglas County to help us maintain our roads in a attractive manner. And we try our best, but something like this can certainly be a major benefit, because it does need to be done. It's a consistent problem we have, unfortunately, with people throwing things out of their windows and that type of thing. So we appreciate that. I'm just going to snap through here real quickly a few PowerPoint pictures, if I can here. That's our sign. I think we've seen this before. We have the template to make as many of these as we need to, depending on the number of volunteers we have to go to pick up the litter. We're thinking of kind of minimizing this year 3 or 4 locations, just to kind of have a trial and error run through to make sure we have it down pat. This is an example of some of the brochures that will be on our website. That's a safety vest that we'll be handing out. I know you can't read it, but I must thank Leah Baez for dressing up these documents for us. We had it typed out on a white piece of paper, and she turned it into this beautiful piece of information. How she did it, I have no idea, but we definitely have to tip our cap to Leah. This is a map that will be on our website. You'll be able to zoom in and zoom out on it to get the locale and the county roads located and identified. We will color code it so that the green roads are going to be the adoptable, allowable county roads that may be considered. We will also, as time goes on, show the roads that have been adopted in a different color, and it will identify on our website who that organization is and that type of thing. We're asking volunteers to do a minimum of 2 miles of road, both sides of our road, and no more than 6 miles of road, both sides of the road. So this is a shot of the Adopt a Road application, and there's a lot of words that are in there. I don't need to read it to you all, but it's been well thought out by our county attorney. So with that, I guess, there's really nothing more to say other than we're excited to go. We have the material to upload to our website, which, by the way, is dcengineer.org. dcengineer.org. And folks that are interested in this will be able to find on our website under our permitting log on that would show these application forms and all this other information. And if not, they can just call our office if they have a problem or don't have access to a computer. So we're excited to see how this turns out. So with that, that closes my presentation, really. And we're here to ask for your approval of this program. Thank you.
Thanks, Dan. Commissioner Friend?
Thank you, Madam Chair. Thanks, Dan. Hey, this certainly isn't specifically relegated to unincorporated areas of Douglas County, correct? I mean, we can do it right down the middle of Dodge Street, couldn't we?
Well, no,
Or
we
is
can't.
Todd Fitzer going to give us problems with that?
It is relegated to the county road system. Let's put it that way. We have
Okay.
an official road map that indicates legally what our county roads are. And it does not include any roads in the city of Omaha, or for that matter, Valley, Bennington, Waterloo. Does not go into unincorporated neighborhoods. Those are not a county road, so we are not planning at this time to do that.
Okay. I was going to make another joke, but that's fine. Thank you, Madam Chair.
Commissioner Kavanaugh?
Thanks for this, Dan. I note that your organization's name here can be applied to these signs. How does your organization get its name added to one of these Adopt the Road signs?
It can be a nonprofit or profit organization. It cannot be a political action group. We will make the sign. The county engineer's office will make the Adopt a Road sign that you're seeing on the screen, or I am at least, and we will put it up. We will actually physically put this up in the locale.
Is there a contribution that the organization would make to the initiative?
We're not planning on that. I guess we'll see, but no, I guess their contribution is cleaning up the county road.
Okay, thank you.
Any other questions or comments? With that, we do have a resolution that we can approve this today. Motion by Commissioner Morgan, seconded by Commissioner Rogers. Please vote.
Motion passes 7-0.
Thanks again, Dan.
Thank you.
And tell all the staff out there, thanks.
I sure will.
All right. We'll move to public hearings. The first public hearing is for a Class C license, beer, wine, distilled spirits on and off sale for Bottles and Barrels, LLC, DBA Bottles and Barrels, 5331 South 204th Ave, Suite 101, Omaha 68022. Manager application is Rebecca Ellsworth of 4418 South 220th Street in Elkhorn, 68022. This is the public hearing. Is there anyone wishing to speak or hear representing this liquor license? I did, is that you? Yes. Okay, could you come down, because we did get word, part of our application process is for you to send out a notice to anyone 500 feet from the location.
Yes.
And I understand that wasn't completed, and is that because nobody lives there or nobody's around there?
It was completed. There was a title report that was.
Oh, that's 246, yeah, okay.
But yeah,
were those certified?
What's that?
Did you have a certified back that they received it and no?
We didn't have anything certified. There was some conflicting messaging there. When I brought it up here, the title company, we had their letter and the addresses of the businesses to send them to. I believe there were
6 of them.
4 or 6, yeah. They were actually mailed out on the same day I stopped up here, handed the information to a very nice woman, I think, in an office over there. But the title company said that they generally didn't notarize it, and I talked to a very nice woman downstairs, kind of asking that same question because we had the same kind of concern, and it sounded like it wasn't going to be any sort of an issue.
Okay. Dan, do you want?
Real quick, Mark, can I get your name for the record, sir?
James Ellsworth.
Thank you. Yeah, on this one, I think it was just the Dan County clerk. Yeah, the search happened. It just, normally there's like a sworn affidavit included, and that was not included. So, but.
But we have the 6 places and companies,
Yeah.
properties in which the notice was sent to for the record.
Correct, yes.
Okay,
Yes.
all right, okay. Any other questions or comments during the public hearing? Seeing none, I will close the public hearing. What is the will of the board?
Move to approve. Second.
Motion by Commissioner Morgan, seconded by Commissioner Friend. Please vote.
Motion passes 6-0. Commissioner Kavanaugh is absent right now, but all our commissioners voting yes.
Thank you. Okay, thank you for being
Thank you very
here.
much.
Next is a public hearing for a Class C licensed beer, wine, distilled spirits on off sale for the Hideaway Lounge, LLC DBA Hideaway Lounge at 3030 South 203rd Street, Omaha 68130. Manager application Brian Shope at 1706 North 206th Street, Elkhorn 68022. Here today is Mr. Mike Kelly. Good morning.
Good morning, Madam Chair. Mike Kelly, 2804 South 87th Avenue, appearing here on behalf of the applicant, and we're here for any questions you might have.
So I need to ask the same question in terms of a title search and notice sent to property owners,
And we,
or if there are no property owners within that radius, could you tell us that?
we just got involved in this application recently, and so we didn't do the original thing. I would defer to the clerk.
Dan?
Dan Ash County Clerk, we, Ellen and Sharon, Ellen Sexer in my office, and Sharon Burke in administration, at least last I checked with them, they had not received anything that nearby property owners have been notified, if they're already within the radius.
And were we able to look up on this one? Was this the one that had the?
Yeah, this one, I can't tell the distance, but it looks like
There's an
there's an
apartment
apartment complex near, it's mainly vacant lots, but then there's an apartment complex that looks like it could possibly be within range.
Okay.
But
And in the past, this board has opted to approve those if there's limited or no residential owners around the property. And so again, during this public hearing, we would ask if there's anyone wishing to speak for or against this. Okay. I'll close the public hearing. What's the will of the board?
Move for approval. Second.
Motion by Commissioner Morgan, second by Commissioner Rogers. Please vote.
motion passes 7-0.
Thank you.
Okay,
Good to
thank
see
you
all
for
of you.
being here. Good to see you. Item C, public hearing regarding the proposed approval of a golf court ordinance to allow golf cars to be driven within Sanitary and Improvement District 177, which is Riverside Lakes. This is the public hearing, and if you would, anyone present would like to come forward and speak during this public hearing, you're welcome to do so at this time.
Thank you, Commissioners. My name is Chris Sim. I'm a resident at 645 Riverside Drive in Riverside Lakes. And I do have a presentation, but I'm more here for just any answers I might be able to provide.
So could you just briefly, as far as presentation, just and just to alert the public that in order for golf courts to be utilized within an unincorporated area of Douglas County, they need to come to the board and go through this process. And so that's what, we set the public hearing date, and now this is the public hearing. And again, today, action can be taken depending on what the board decides. So if you want to just walk through your area in which the golf courts will be utilized.
Absolutely. So I'll just set this there.
Yeah.
Riverside Lakes is an isolated lakeside community south of Waterloo, Nebraska. It consists of 210 homes configured in a figure-8 street layout. The neighborhood is only one way in and out and consists of a single stop sign. Because of the orientation and location of Riverside Lakes, there's really no reason or probability that a golf cart should even leave the neighborhood if we're granted this access. We have a residential speed limit of 25 miles an hour. Golf carts average about 12 to 14 miles an hour on their own. Low-speed golf carts are a perfect match for Riverside residents. They provide a very enjoyable experience getting somewhere while saving money and not impacting the environment. The small footprint of golf carts allow easier off-street parking and less traffic congestion. They allow residents to easily enjoy their surroundings, enjoy the open air, visit friends, and attend neighborhood events. Golf carts also allow elderly residents and those with physical challenges to get outside and visit their neighbors. They even will occasionally take their pets for a ride in little dog carriers at about 9:15 every morning, going about 6 miles an hour. That's a true story. It's fun to see. Riverside Lakes is an active community with many events throughout the year. We do have a 4th of July golf cart parade, drive-in movie nights in the park, and an HOA-sponsored event such as the Easter egg hunt, summer fun days, and an upcoming fall fest. Families being able to drive golf carts to these events is a huge benefit to the turnout and participation of these events. Riverside Lakes also has a centralized park with tennis, pickleball, and baseball fields. Parking is very limited at this park, so the golf carts allow for less congestion and safer transportation to and from these events. To sum it up, really, Riverside Lakes is an isolated community of responsible residents. With our simple street layout, a single stop sign, and our isolated neighborhood as a whole, it's a perfect, safe, and natural match for what we believe is a transportation option for Riverside Lakes.
Thank you. We do have a couple questions. Commissioner Kavanaugh?
Thanks for this. I'm just looking at the map. It appears that there's like 2 ways in and 2 ways out. Is that pretty much it?
Actually, there's, I don't know if you guys can hear me.
I can see it.
Okay, yeah. There's only one way in and out, which is right here. So
Oh, that South Shore Drive isn't, oh, I see, okay.
No, it stops. Yep, so
One,
it's
okay.
basically a big figure 8 around
Right.
those 2 lakes.
And all of the golf cart traffic would be enclosed in that?
Yeah.
Nobody goes out on the, what is that, 200 and?
228.
Yeah.
And this turns into a gravel road down here, and it goes down to Pacific, so it's kind of a one-way road anyway.
Mm.
Yeah, there's no reason for a golf cart to even go out.
This is all residential? How many homes?
210.
Are they all built?
Yep.
So you could conceivably have like 200 golf carts buzzing around?
Conceivably, yes.
Is everybody gonna get a golf cart?
There are quite a few already, and we do see them, out enjoying the activities and driving around to visit friends and family. So
Yeah.
there could be a few golf carts.
Okay, thanks.
Commissioner Friend?
Mr. Heim, thanks for the information. Can you tell me through the application process, first of all, I'm gonna vote for this, so don't worry
Thank you.
if you're worried. At least I think I am, unless you say something really weird. Can you tell me what the application process looks like when it comes to, this county board doesn't have a tremendous amount of statutory authority or ordinance authority. This is one of the limited areas where the legislature allows us to create these type of requirements in ordinance. With that in mind, does the sheriff's department, as part of the application process, working with the sheriff's department and reporting to them information about how many of these carts are running around, who's driving them, who owns them, stuff like that? Is that part of the application process? And I'm a little ignorant as far as this goes. You just went through it.
Sure. It is not currently part of the application process, but we are willing to adopt all reasonable means and measures for safety and for road compliance as needed. So We can add safety equipment to the golf carts. There's a lot of seat belts, light kits, turn signals, etc., that are standard for situations like this, that we can make sure that the golf carts are equipped with.
Yeah, perfect. Did anybody from the sheriff's office actually call you and say, hey, you get this, we're gonna come over there a little bit and make sure, 12-year-old kids aren't running stop signs and stuff, right?
No, but we would welcome that, quite honestly. We are,
Yeah, okay.
we want to set rules so we can self-regulate and enforce those rules to make sure everything's safe.
Okay, that's great. Thanks for the info.
You bet.
And I was just reminded that in 2019, we did this for a subdivision called Deerfield, and have not had issues or any special requirements. So just background information. And we also have one coming up as another public hearing. So, all right, this is the public hearing. Is there anyone else wishing to speak during this public hearing?
Wayne's hand is up.
Oh, Wayne, oh, sorry, Chief Deputy, I didn't see the hand there. Sorry about that, go ahead.
No problem. Good morning. Can you hear me okay?
Yep.
Yep. No, we are, one thing that this gentleman said that we are all for is that they're going to police themselves. And that's a big help from us because what we have seen in other neighborhoods is young kids driving these golf carts and get into accidents. So we respectfully ask that they please do that and police themselves so that we don't have to.
Yep.
Absolutely.
Okay. Thank you. Any other questions or comments during the public hearing? Seeing none, I will close the public hearing. What is the will of the board? Motion by Commissioner Rogers. Commissioner Boyle seconded. Patrick?
Sorry, Patrick Bloomingdale, County Administrator. In order to take action on this item today, there first has to be a vote to waive the 3 reading requirement. And 6 of the 7 need to vote in favor of that in order to waive that. And if you are able to do that, then you can next vote on it.
Thank you, I forgot about that. So the first vote, again, we'll withdraw that from the floor. The first vote is to waive the 3 hearings. Motion by Commissioner Morgan, seconded by Commissioner Rogers. Any questions or comments? Please vote.
Commissioners, on these, sorry, Madam Chair, on these, we need to do a voice vote. So that's just the way it is in the statutes for this.
Teresa, York County Attorney, that statute specifically calls for a voice vote and that then your votes be recorded. So we've advised the clerk to just follow the statute. We apologize for the inconvenience.
That's fine, go ahead.
All right. Commissioner Boyle. Yes. Commissioner Kavanaugh. Yes. Commissioner Friend.
Yes.
Commissioner Garcia. Yes. Commissioner Morgan.
Yes.
Commissioner Rogers.
Yes.
Madam Chair.
Yes.
Motion passes 7-0.
Okay, so now we can go back to the action item to approve the golf cart ordinance to allow the golf cart in Riverside Lakes.
Okay. Commissioner Boyle.
Yes.
Commissioner Kavanaugh.
Yes.
Commissioner Friend.
Yes.
Commissioner Garcia. Yes. Commissioner Morgan.
Yes.
Commissioner Rogers.
Yes.
Madam Chair.
Yes, and just to note, Commissioner Rogers made the motion and Commissioner Boyle seconded for
yes.
that motion.
Yes.
Okay.
Thank you. And motion passes 7-0.
Okay, thank you all for being here. With that, we'll move to committee discussions. First is the finance, the budget report as presented. And then we have a few ARPA. The first is the resolution approving a pandemic-related premium pay supplement effective October 2nd, 2022 through April 1st, 2023 for eligible county employees per the limiting terms included within this resolution and authorizing the execution of memorandum of understanding between Douglas County and the various collective bargaining groups as specified. Is there a motion to approve? Commissioner Kavanaugh, a motion by Commissioner Rogers, second by Commissioner Morgan. Commissioner Kavanaugh?
Thank you. Just a couple of questions for the record. And Joe, you and I have talked about this. The source of these funds for this premium pay?
It's going to be eligible under the ARPA awards. So We received our second installment of $55 million, and so this will be funded from that second installment of our ARPA money.
From the ARPA 2 installment, yes. Okay, and the approximate amount that this would be?
$3.7. I'm sorry, Marcos, what? 3.7 is the number we received from the HR department that it would cost.
$3.7 million.
Yes.
And the number of employees covered by this would be?
A little over 800.
And these essentially are all county employees, exclusive of elected officials, that weren't covered by the previous premium pay packages that we put forward?
Yes, that's correct.
This kind of came up in the context of what OPS did with some of their employees. In terms of the payment, how will they actually receive the premium pay? Lump sum? I know it's an hourly. Will it be per pay period? What can you tell us?
I'm going to let Marcos speak to that as he's been kind of working it day to day.
Yeah. Marco San Martin, Douglas County Labor and Intergovernmental. So Commissioner, the employees will be paid this on an hourly basis throughout their work week for those hours that they actually work. So if you were to take vacation, sick leave, et cetera, you do not get that $5 per hour premium added on to your hourly rate throughout the week. And so, yeah, that's exactly how it will be paid. So it is paid in every single pay window between October, I believe that we said October 2nd through April 1st.
Is there any kind of a range, like a minimum and a maximum amount that people would be paid?
No minimum and max. I mean, it's $5 an hour added on to each individual's base pay of whatever hourly rate that they're working at. So, I guess what necessarily? If somebody's working full time, let's say somebody's working full time, and this is about a 6-month window. So let's say they work full time, 1,040 hours. That's not counting any vacation, sick time, time that they're gone. So 1,040 times $5 an hour. So about 5,200. I would be, but that would be on the high, because they would be probably be taking vacation, sick leave, et cetera, between that's in that 6-month window. Does that make sense?
Yeah.
It's hard to express that.
1,040 hours, you're just taking the time period and saying basically 40 hours a week?
Yeah. Mm-hmm. Yes, exactly. Based on if somebody was working full time, 2,080 hours in a work year. And this is running for approximately a 6-month window.
And Commissioner, the big criteria on this that was in the final ruling from the Treasury Department, that it's all essential workers at government are eligible, and their definition of essential workers are people who come into the office. So this would not apply to people who are working remotely from home.
One minute.
In order to qualify, you have to be coming into the office to receive this pay.
Okay. And are all of these 800 people on hourly compensation packages, or are there salary employees who aren't on hourly? And if so, how do we figure that?
Commissioner, it's a mix. There's hourly and there are salary, and we still have to account for their hours on a weekly basis in the payroll system. So regardless, it's applied the same to all employees.
Okay.
The concept, I should say, in payroll.
Okay. So, I mean, the hourly employees, somebody keeps track of their hours and reports them to payroll. On the salary employees, will somebody be keeping track of their hours and reporting them to payroll?
Yes. Yeah, and that is, as an example, our hours are reported to payroll by our office manager, and most of us are salary.
Yeah, it's all in the Oracle payroll system.
Yeah.
Time.
Okay. Then I got
Any other questions or comments? Commissioner Kavanaugh?
And so you, as a salaried employee specifically, are eligible for this, right?
That is correct. County administration is.
Yes.
Mhm.
And so normally, you work a 40-hour work week, but you work more than 40 hours sometimes, and so that would be calculated as well?
No, sir. We don't get overtime. We do not get overtime in county or at least the employees I'm aware of. We're not.
Okay. Maybe the county attorney can help me with this. I think county attorneys are salaried employees, not hourly.
Yes, the attorneys are. I think what you're driving at, and if I'm wrong, just correct me, is for exempt employees, it is not uncommon that we work more than 40 hours a week. We don't receive overtime. That is accurate because we're salaried and we're exempt. And so I am guessing that perhaps there is a presumed 40-hour work week for the purposes of the premium pay, and that you would go with the 40-hour work week, whether a salaried employee works 45 or more or something like that. So.
Okay. So the salary employees that would be receiving this premium pay would be 40 hours times the number of hours in this category. I think it runs from a specific date of October 2nd, 2022 to a specific date of April 1st, 2023, right?
That is correct, sir.
And I think, Commissioner, if I may, I think it would, Marcos, correct me if I'm wrong, but you'll take out vacation, you'll take out sick, so it would presume a 40-hour work week minus any paid leaves.
That is correct.
Yeah.
Okay. So if it's 6 months and based on your 2,080 hours per work year.
That's right.
On a 40-hour week, that's 1,040 hours times $5 an hour for the salaried employees.
That is correct. And that's how I came up with that 5,200 as a ballpark estimate. But also needing to take into account vacation doesn't count, sick time doesn't count, your compensatory, so none of that. It's only for hours actually worked,
Absolutely, I understand.
at work at your desk,
Right. So, I mean, that's going to be kind of a pretty certain number for salaried employees, but the hourly employees could vary over that because they could put in overtime.
That's correct.
Okay.
And so all of this is consistent with the prior resolution that we did in January through June. It is consistent with that because there were a mix of employees, both exempt and non-exempt employees in that prior round.
I see. All right, very good.
So,
Thank you. Well, I saw when Perkins County did this, and I think they did a blanket $4,000 per employee more than a year ago, and recommended to the board that we do something. And we've done it for a variety of other departments, so it just seems equitable that we follow that with all employees who pretty much have suffered the same exposure if they're coming in to the COVID pandemic. So thank you.
No other questions or comments? Chief Hudson, was that a hand left over?
No, it's a new question. Just so I'm clear on the ARPA funds, it doesn't cover department heads and elected officials and their chief deputies, correct?
Not elected officials.
But it does cover department heads?
Yes.
Yes, that is correct. Yeah.
And it does cover the chief deputies?
Yeah.
Okay.
All right. No other questions or comments? There was a motion and a second, correct? Okay, please vote.
Motion passes 7-0.
Next item is an ARPA funding, approval of a resolution approving the payment from ARPA funding to the Public Building Commission for air handling unit replacement on sea level of Civic Center in the amount of $1,132,000. Is there a motion to approve?
So moved.
Motion by Commissioner Morgan, second by Commissioner Rogers. Any questions or comments? Please vote.
Motion passes 7-0.
Next is an ARPA funding approval of a resolution authorizing the award of $258,785 to the Avenue Scholars Project to support programming initiatives, including the student support team, the business outreach team, and summer boot camps. This is being funded, invested through the allocation of Commissioner Morgan and Commissioner Friend. Commissioner Kavanaugh? Well, is there a motion to approve? Motion by Commissioner Rogers, second by Commissioner Morgan. Commissioner Kavanaugh?
I think that you just answered my question on this. I was going to ask on the previous one for the Public Service Commission, is that basically out of our ARPA 2?
Correct.
Okay.
Correct.
Thank you.
No other questions or comments? Please vote.
Motion passes 7-0.
Next, we have an ARPA funding approval of resolution authorizing the award of $30,000 to Julian Young Business Advisors to fund a small business recovery and resilience initiative. This is being invested through Commissioner Morgan's allocation. Is there a motion to approve?
I'll second. Also make a comment when it's appropriate.
Did you make the who made, Commissioner Rogers made the motion and Commissioner Morgan seconded it, and Commissioner Morgan?
Julian Young has a business at 30th and Ames. I went out to his office and talked with he and his wife, who are working on trying to help businesses get started, and they've done that for some time, so that's what this is about.
Okay, thank you. Any further questions or comments? Please vote.
Motion passes 7-0.
ARPA funding, approval of a resolution authorizing the award of $132,968 in ARPA funds to IB Black Girl to fund a community-based birthing resource center located near 24th and Lake Street in North Omaha. This is being invested through the allocation of Commissioner Rogers. Is there a motion to approve?
Second.
Motion by Commissioner Rogers, second by Commissioner Morgan. Any questions or comments?
Larry Store, 5015 Lafayette Avenue, Omaha, Nebraska. I'm not opposed to this in principle, but in wording, I am. And the reason is, I believe this is right out of what years and years ago was called critical theory. But the words used in this resolution are, in modern terms, right out of critical race theory. I have lots of different sources that tell us what those words, buzzwords are, and it goes right along with some of those that are in there. I'm not going to read the resolution. I'll just hit some of the words that come right out of the critical race theory buzz list. And I'm asking you to rephrase this resolution and any other resolution that is as divisive as this one is. Now, people that have not read this resolution, like me, I did. And I'm very much offended by it. Number one, if this is so necessary, then this is accusing our healthcare community of not providing quality health care for Black women in the birthing process. Excuse me? Name the people that are not providing it, and let's take their license away. Let's close those hospitals. We won't need them if this place gets going. Why do we need a separate one? It's divisive. You need to find another way to help these people. I'm not against helping them. But why can't our local providers that are already here help them? Those that have a real problem can go and say, this is my problem, now help. Or they can come here and say, I need the hospital to help me birth this child properly. We shouldn't have to do that. Whereas. But let me read some of the IB black girl right there. That's offensive. Black women, racism, sexism, adultification, transphobia, race and gender, structural barriers, systemic oppression, disparate rates, reproductive justice, creating a radical change-making culture. Black feminist and womanist, our organization provides transformational change. That's a challenge. At the intersection of gender and race, that's a challenge. That's offensive. We need to stop this. Liberation, autonomy, abundance, liberation. That's sort of Marxist, sort of communist, sort of Hitler. We need to stop that. Reword it. Black maternal health and birth justice initiative. Oh, racial justice, racial injustice, criminal justice, social justice initiatives. That's out of the critical race theory. Birth justice, excuse me. That doesn't make a lot of sense. Need to reword it. Our goal is to access quality and culturally relevant maternal health services through policy, research, advocacy. In other words, let's change everything radically. That's critical race theory. No black mama
1 minute.
or birthing person? That's offensive. Quality of care and information they receive. Apparently they have never received it. Who? Who didn't and who didn't provide it? Let's name them. Let's take their license away. Ensuring black women and birthing folks don't just live through their birthing experience, but they thrive. Well, we all hope for that. Unacceptably poor maternal health outcomes. Imperative for the healthcare system to address why. Well, let's get them down here and address why in public. We can have two-way discussions, but some of your lawyers say you don't dare do that. You don't reply to citizens. Then don't bring it down here in a resolution either. Thank you.
Commissioner Boyle and then Ashley on Zoom.
So I do appreciate this funding going forward. First of all, it's very well known in the medical community that birthing people, especially black folks, have higher death rates than any other demographic in the United States, which is very embarrassing as a developed nation to have that statistic. This is not just about poverty or social issues either. There are studies that show that college-educated black women and black birthing folks have worse outcomes than white folks in general. So it's very important to address the issue, and that is what IB Black Girl is trying to do. It's well known that when you look at the types of things that occurred in studies in the healthcare realm over decades and decades in the United States, there are lots of things that occurred that violated black folks that white folks really simply wouldn't tolerate. For example, the Tuskegee Airmen trial or of clinical trials, there's a woman named Henrietta Lacks who really is the basis for all of our antibiotic formation. There were cells that were taken from her own body's cells that were taken from her to develop antibiotics, and she was a poor black woman. So it's very easy to see that there has been discrepancies in healthcare outcomes and based on just simply the system of the healthcare system in and of itself. Sure, you could try to go in and take individual licenses away, but at the same time, as a physician, I can tell you, I admit, first and foremost, I have implicit and systemic bias. I try to overcome that. So it's not always something that we recognize, and I think we need organizations like IB Black Girl to open our eyes to what needs are, and then help rectify and fix those problems that are broken. So I'm 100% supportive.
Whoops, okay. Thank you.
Thanks.
Commissioner Ashley, Commissioner Kavanaugh and then Ashley.
Thank you. And I want to commend Commissioner Boyle's leadership on this. When she came to me earlier in this year on this program, I enthusiastically joined her in some initial funding, and I commend Commissioner Rogers for joining in. We've received briefings from our own health department over the years, and this has really troubled me, that show pretty significant disparities in infant mortality rates between our African American mothers and our Caucasian mothers in Douglas County. In Douglas County. Almost within sight of the University of Nebraska Medical Center, which we all fund and are very proud of, rightfully so, for its provision of health care to our community. But that's a terrible indictment, and if we can do anything, as Commissioner Boyle has pointed out, and as this program is going to attempt to do, to close that disparity between black mothers and white mothers, infant mortality rate, dead babies, well, we should do it. I mean, it's just wrong that we, in this wealthy community, in this wealthy nation, have disparities geographically not very far apart. We're talking a mile or two between white mothers' babies and black mothers' babies. If that doesn't bother you, it should. And if we can do something about it, we should. And so I want to commend Dr. Boyle and Commissioner Rogers and pretty much the whole board who I think has supported these initiatives to try to close that gap. We have the resources to do it. We have the doctors and nurses and health centers to do it. And it's just a matter of political will to do it. So I'm happy to join in anything that we can do to make that disparity go away. We shouldn't have that. It's wrong. And so thanks for doing this, and I'm glad that we're addressing this problem head on.
Thank you. Ashley? There you are. Good morning.
Good morning. Hi, everyone. So I'm Ashley Spivey, pronouns she, her, and I'm the founder and director of IB Black Girl, and I'm excited to be in front of you all again for this work. As a reminder, our goal at IB Black Girl is really to center those most impacted. And we know for sure that when you center those most impacted and take a targeted approach, then everyone benefits. So our work specifically in the birth justice space is impacting Black pregnant people, Black people with the capacity for pregnancy, Black women. And we know that when we do that, because of our outcomes that Commissioner Boyle named of having mortality rates 3 to 4 times those of our white counterparts. In Douglas County, we just heard that our babies are dying at 12% rate that compared to our counterparts, which is the highest it's ever been. And so when we target those most impacted, then there are ripples because of those interventions for all women, for all babies. And that has always been our approach and will continue to be our approach. I'm excited for this resource center because it really allows us to catalyze in community the solutions and partnerships to help to try to move the needle on an issue that is accessible. Us addressing the maternal health crisis for Black moms and pregnant and birthing people is not something that cannot be transformed. It's not an issue that is so complex that we cannot start to see movement. And I'm excited for what we're doing in this resource center space to really help to catalyze that. And we actually have medical partners at the table. So 2 out of the 3 largest institutions across the state have been committed to this resource center, are committed to our Black Maternal Health Coalition that we operate monthly for interventions. We are launching our doula pilot in partnership with the Nebraska Perinatal Collaborative, which will have statewide impact, and also drill down to what does that mean for the largest populated county in the state. And so we're seeing a lot of movement and seeing that commitment from the institutions that are responsible for these outcomes. There is a brilliant scholar here in Nebraska, actually at UNL, Dr. Deidre Cooper Owens, who has a book called Medical Bondage that actually looks at the history of obstetrics and what it was built on, which was the torture and experimentation of Black enslaved women and folks with the capacity for pregnancy. And so that initial origin of this field around serving pregnant people, serving women, and birthing people, it's embedded. And we see that institutionally. And I am really proud of our medical systems here for acknowledging that, starting to reconcile that and say, then how do we move forward, and really curating those solutions and ideas and interventions in partnership with, again, the people most impacted. And so I know I will see y'all probably a lot more as I report out on all the things that are happening. But I think this is a really great first step in having a community-based space that really is hyper-focused on how do we change the outcomes for Black moms, birthing people, and our babies. So thank you for this investment.
Thank you, Ashley. Commissioner Rogers?
Thank you. Thank you, Madam Chair. First, I want to thank my colleagues for the defense of the funding, and thank Ashley for her elegant example of it. I guess I just want to say, and I feel like I need to say this, and comments made every week that criticize words like structural racism or everything to do with color is CRT is the reason why I pretty much feel like I got to say this. I want to thank everybody for their defense, but everything that has something to do with color is not CRT. And so if you want to ask the question of why somebody has to talk about structural racism, they have to talk about it because it's exhausting to a Black person to have to come up here every week and clear the wind of this indoctrination that is going on with CRT. Everything to do with color is not CRT. It is scientific based. And it's like I can't let it slide because somebody's going to hear this and think it is fact, and it is not fact. So if you want to answer to why all this language is it's because there continues to be uninformed opinions voiced about a subject that nobody knows anything about, and it's taking a buzzword and tainting it. So I want to thank everybody for the defense and thank you for the support.
Thank you. No other questions or comments. We did have a motion and a second. Please vote.
Motion passes 7-0.
And the last Finance Committee item is the monthly fee report from the clerk's office. We will move to Community Services. We have a first one is a resolution setting the public hearing date of Tuesday, October 4th to consider golf course ordinance for SID 559 Indian Point and SID 580 Indian Point 2 of Douglas County, Nebraska. Is there a motion to approve?
Commissioner Borgeson, I'm sorry, I just want to make one correction.
Oh, yeah, one correction, that's right.
In the resolution, it says SID 558 instead of 559, so if I could ask that, correct that to 559. Thank you.
All right.
Madam Chair, I'm sorry, can you tell me who made the motion and second again?
Commissioner Rogers made the motion and Commissioner Morgan seconded it.
Thank you.
Please vote.
Motion passes 7-0.
Next is a reallocation of the 21-22 Visitor Improvement Fund Grant Award for Omaha Economic Development Corp. And Catherine Hall is here if there are any questions, but is there a motion to approve? Motion by Commissioner Rogers, second by Commissioner Boyle. Please vote.
Motion passes. Commissioner Borgeson voting no, other commissioners voting yes.
And my no is just consistent with my vote for the whole that we had earlier in the month of the LB 262 fund. Next is the criminal justice. We have one resolution to accept and approve a community wildfire protection plan. And with us today is Paul Johnson, our emergency management director. And if you want to come down, Paul, and just give a 3-minute, 5-minute explanation of what this is, if that can be accomplished, that'd be great.
Paul Johnson, Director of the Douglas County Emergency Management Agency. The Community Wildfire Protection Plan, this is a statewide effort that's going across the state of Nebraska to all 8 planning, exercise, and training regions. And the focus of the community plan is to actually allow for grants that communities and individuals can actually apply for. It's primarily of concern, of course, out in western Nebraska, where the forest fires and grass fires are sometimes difficult to abate. And every once in a while we get a grass fire here in Douglas County, but it's rare. But by and large, it is like I say, a statewide effort. I was told that the money actually originates from the 2008 Farm Bill or something like that. So it's it's a long time coming, so it's finally here. But anyway, it does provide some options for communities, especially those out west, to obtain equipment and to actually use some of the monies to remove dead tree debris and this type of thing that would offer as kindling and fire starter problems. So if you have any questions about the plan, I'd be glad to answer them.
Okay, I don't see any lights, but thanks for being here. This is an interesting one that we hadn't had before.
Thank you.
Thank you
very much.
With that, is there a motion to approve?
Second.
Motion by Commissioner Rogers, seconded by Commissioner Friend. Please vote.
Motion passes 7-0.
Next is our Human Resources Weekly Personnel Report from Civil Service. As presented, no legislative items at this meeting. There is a HR committee meeting at 2 o'clock this afternoon in room 903. We do have need for an executive session for litigation, legal advice, and labor negotiations. So with that, do I have a motion to go into executive session for those purposes?
So moved. Second.
Motion by Commissioner Morgan, second by Commissioner Rogers. Please vote.
Motion passes 7-0. Motion passes 6-0.